This is Global Health Tube. Subscribe, share, like, and comment the channel and get an updated infos always.
So title is not important. The important is to address the problem, to find a solution for a problem, so to work on the same framework. Under that framework, you can have a coordinator, a team leader. Under that framework, you can have title, but the title you brought from your department or discipline no more works here. So working as a team and highly connected, participation in planning and decision making, hierarchical relationship, I said it, team members are equal voices. There are roles and responsibilities, but sharing of expertise and experiences, willingness to work together towards an agreed purpose, trust and respect among collaborators. Is transdisciplinary collaboration easy? Just, it's not easy. Because people will come with different egos. Know what I say should come first. I'm not going to accept what you are saying because I am the expert. It's not easy, but when you work through those difficulties, those are teaching moments for the next team meeting or next transdisciplinary intervention. You will learn that and you will improve, because if you pass that and work together, you will see the result. The result is very, very beautiful. I had the opportunity to work on a project that took me to Borana before COVID. Health education, culturally competent health education, and behavioral health intervention for the prevention and control of brucellosis in Borana. That is the project I was coordinating. And there were many ups and downs because the team, my team, I was the only one from the US, and there were other team members from the Public Health Institute of Public Health Sciences. So every now and then, while we were in Borona, arguments will occur, but each time I will make it a point to see it and address those issues in a very pleasant way. So we implemented, despite all the ups and downs, we implemented a transdisciplinary approach intervention in Borana. Three-phased project. We developed 10 core teams in Borana, different parts of Borana, in rural Borana, in Arero. We traveled because we were in a team. We had arguments, but each time when we succeeded to have a product, it gave us energy. So it was a great project. It was a very successful project. My last trip was, the program interrupted because of COVID. We implemented 2 phases. The third phase was remaining while COVID happened. So I was very enthusiastic. So it was a CDC funded project. So CDC said, I have, funded it twice. The third time is not going to happen. So COVID is there, what can we do? In 2021, I said, let me give it a try, and I went to Borana. We provided One Health approach training for healthcare professionals, educators, teachers in one group, because the project was transdisciplinary. It was beautiful. Everybody was amazed. Doctors, veterinarians, teachers came together to take the training. So when you pass the ups and downs, the result will make you happy. So it is a very beautiful endeavor. Key steps, there are steps, as I said, it's not easy to have transdisciplinary intervention, there are ups and downs. So these are the steps: identify the priority population or group, identify priority problems to thorough collaboration. This is the socio-ecological framework, conceptual framework. Yes, of course, if you are working as a transdisciplinary team, you need a common framework. The socio-ecological framework is thinking at different levels. What is the problem? What is the solution? How can we address it? For example, is there a policy at higher level? Is there a policy gap? At a community level, is there, what is the problem? Are there resources in the community? Why the problem happened in the community? And at organizational, institutional level, what can institutions do to address that problem? When we come to personal, we have to know the knowledge, attitude, practices, skills at individual level. So when we say the socio-ecological framework, putting the problem, identifying the problem from policy, community, organization, institutions, interpersonal, and personal level, identifying the gap at each level. So the third one is identify relevant transdisciplinary collaborators. Of course, when you think about, to address a problem, you have to think, what are the disciplines that will help me, or the disciplines that should I invite to promote my idea? So you have to think the disciplines. The fourth is assess the extent of stakeholders' agreement. The other one is engage community opinion leaders. Of course, as I said, if you are working with the community, engaging them earlier is very important if they should. 6, assess community buy-in into the problem and community participation. Of course, the problem you are trying to address shouldn't be paternalistic, meaning, for example, I see a problem, a health problem, the prevalence of tuberculosis is high in the community. As a professional, I have seen the problem because there are many patients coming to the clinic, so I am aware about that. But if I want to intervene to address that issue, to work on the prevention side, I am thinking to engage different, disciplinary, different professionals. So what, I shouldn't be going to the community with all the plan done by myself or by my team without engaging the community. That's the problem that I have identified as a problem. Does the community think it is a problem to be addressed? Is it me or the community is with me? So the problem you are trying to address should be a problem to the community too. You have seen TB the problem because patients are coming. Does the community see it the same way? Are they interested to address it? If there is no community buy-in, the intervention is not going to happen. So somehow you have to make the community see, aware about the problem. So this is a different topic. We will discuss it in community engagement that we are going to do this afternoon. So the other is establish a reliable communication channel. Yes, it is important. So you sit together, maybe I'm from a different city, I'm a different country, so we are going to build a transdisciplinary team. Reliable communication channel is very important, basic. When I was working with the team in Borana, for the infrastructure, part of the infrastructure assessment was knowing, understanding how should we communicate with each other. Because it was needed. I'm in the US, the other team is in Addis, the other team members are in Borana. How is the project going to happen if we are not communicating effectively? So what we did was, we asked each core team member, how do you want to be communicated? By phone, text message, email, how? So this is very basic and very important. So when shall we meet? Every week? Every month? What day? What time? All these are effective communication channels. If you don't discuss this, the project is not going to happen. So this is very basic and important. So why transdisciplinary collaboration? You have seen it from the video clip. That is the answer. Because our problems are so complex and interconnected. So one discipline alone cannot address the problems that we are facing today effectively. So working together is not optional. So as people, as professionals who are going to solve, who are trying to solve tomorrow's problems, transdisciplinary collaboration is a must. Because as you see, from here, if we start from lack of education, the result of lack of education can be related to unemployment, can be related to conflict and displacement. If there is conflict, there is no employment, because in conflict, every institution can be destroyed or disrupted. So environmental pollution, that it affects everything. Hurricanes, disasters, earthquakes, displaced people. Next, pandemics. We have seen it during COVID. Increased chronic disease prevalence. We can see the effect. So poor access to health care. Lack of education can be related to poverty. Poverty can be related to poor access to health care. Increased disease prevalence. You can pick one. You can connect one of them to all of them. You can connect all of them to the middle one. So can you say one discipline that will solve everything? So transdisciplinary collaboration is very important. And in countries like ours, like Ethiopia, where we are talking about lack of resources, working together is a must. Exchanging ideas. Maybe I have, as a discipline, I have a surplus of products in my department. So when we work together, I can say, oh, I have this, you can use this, we can use this, I have this, I am not using this. So even sharing resources comes with working together, coming out of our box, getting understanding among each other is very, very important. So now it's your turn. I've been talking for more than 30 minutes, I think. So now it's turn. So there is no, it's not a question. It's sharing what you think about this. So your reflection should be based on these two scripts. Relevance of transdisciplinary collaboration to your home institution and priority community programs that can be addressed through transdisciplinary collaboration. As you see, the objective of the presentation is understanding, explaining, and applying. So this is applying part. So please, there is no right or wrong answer. Share your ideas, communicate. Thank you so much.
This is Global Health Tube. Subscribe, share, like, and comment the channel and get an updated infos always.